I reached out to Bailey last week and was asking her if she would be, number one, interested in joining us today and telling us a little bit about what's going on with Broadmoore Medical Lodge. We want insight, as well as our main intention here is to find out how we can support them. So Bailey, tell us a little bit about your new position there, okay? And thank you for being with us today. Tell us, I don't know, you probably got all kinds of things to tell us. Just go for it.
I've got a little something worked up.
Yes.
Thank you guys, first off, for giving me this opportunity to speak to you guys. And also for all the unconditional support for Broadmoore and our senior community during this pandemic. Again, my name is Bailey Lombard. I am the new clinical liaison for Broadmoore Medical Lodge. I was previously in the admissions position. If you have not heard of Broadmoore, we're a skilled nursing and long-term care facility here in Rockwall. And I wanted to speak to you today, not only to give you insight on how Broadmoore and what Broadmoore has done during this pandemic, but also to kind of speak as a whole of what skilled nursing and long-term care facilities are doing to make sure that their residents are protected. I'll also be happy to answer afterwards any questions that you do have regarding Broadmoore or skilled nursing as a whole. In February, we watched a crazy virus sweep through China. Little was known about it, and little did we know how it would impact the US. However, skilled nursing facilities began to prepare. By early March, we were stockpiling PPE from wherever and anywhere that we could get it. We began screening and isolating our new admissions. We also began screening all visitation. We started in-servicing all staff and requiring staff to only work at one facility. Broadmoore made the decision to close our doors to visitors completely on March 11th, which was actually a week prior to Governor Abbott order on the 19th. We wanted to ensure our residents' safety. I do believe a common misconception is that this meant only the facility employees were entering and exiting the building. That is not the case. Often long-term care patients require specialized things such as dialysis, specialty appointments, procedures, labs, and x-rays. So what long-term care facilities were doing when this needed to take place, we're providing our residents with PPE prior to them leaving the building. And we also screened all non-essential employees, and they were required to follow all infection control policies implemented by the CDC. Also, at this time, many facilities began preparing a specialized COVID unit. These are closed off from the main facility. They also began communicating daily with DSHS and local state leaders as well. And they also received an epidemiologist assigned to the building to ensure all measures were being correctly implemented. The epidemiologist spent considerable amounts monitoring not only the facility's processes, but the PPE supply, infection control protocol, and disinfecting routines. Broadmoore went as far as to isolate shared ventilation systems in preparation. We also ensured we were fully stocked with PPE for not only the staff, but the residents as well. On April 17th, we were notified of our first positive COVID case. We immediately notified the Public Health Department, HHSC, our medical director, Dr. Bonaquisti, our local public health authority, and Judge Sweet. We continue to provide real-time updates, and we continue to communicate daily. We also did notify all families and employees the same day. At this time, state and local resources did not have enough access to provide testing for our whole facility. So our administrator worked directly with our corporate office to secure testing for our entire facility. Testing is so vital to identifying and minimizing the spread of this virus. Personally, I was shocked to see how many of our high-risk population was asymptomatic. This makes the widespread testing imperative. Many facilities have started implementing testing at some level. Broadmoore and its sister facilities have chosen to test residents and employees weekly, regardless of COVID being in the building or not. We were also fortunate enough to be able to maintain a fully staffed facility and fully stocked PPE during this pandemic and ongoing. Some facilities are not as fortunate. But as the numbers continue to raise, our healthcare field is at a higher risk than ever. CMS.gov reports over 118,000 confirmed COVID cases in long-term care facilities. I do not believe that this is a reflection of the care given in these facilities, but a reflection of how contagious and awful this virus is. Particularly Harvard Medical School, Brown Public Health, and the University of Chicago did a study, and they found that the quality rating of a facility was not a factor in the outbreak and could find no link between this facility's star rating and COVID outbreaks. They did, however, discover that location of the facility, asymptomatic spread, and lack of testing were key factors in outbreaks. This leaves facilities juggling maintaining resident safety and visitation with their loved ones. So many facilities, including Broadmoore, have set up window visits with room numbers clearly in the windows so families can easily find their rooms. We've ensured that there's phones in every room so that they can easily contact their loved one. And several staff and employees are helping the residents FaceTime with loved ones daily. As more is learned about this virus and more facilities are implementing testing, I do believe that long-term care facilities are a safe place for our aging population to go during this pandemic. The people who have chosen to work in healthcare are here because we love unconditionally, we're empathetic, and we care with every ounce of ourselves. Every resident is our family, and every loss of a patient is a loss of a loved one. I truly believe that love and support will carry us through this pandemic as we continue to stay home and wash our hands and follow proper protocol. I hope I've been able to bring some insight into how skilled nursing and Broadmoore are continuously working to protect our residents. I would like to invite you to like our Facebook page. We have some great COVID success stories. We are now COVID free, which is awesome to say. We've come quite a long way. But there's some great stories on there as well as staff highlights. And just thank you again, and I'm open to any questions you guys have.
Awesome. Wow. Can you say that again? COVID free.
We are COVID free.
Right? I know you've been waiting to be able to
Yes.
say that.
Congratulations.
Yes.
Yeah, thank you.
I know it has to have been a lot of hard work from every single staff person there at your place. Bailey, hats off to y'all for doing that.
Well, thank you. It was an interesting time. I have to say, you don't ever expect what you end up with, I guess. But we have an amazing team. I can tell you we have some awesome caregivers that volunteered to work our COVID unit. They were dedicated directly to those patients. So they entered and exited through a separate door. We closed off that wing completely. And we've just had some really good people step up for us, and became closer and just have a wonderful team here. I'm very excited to be a part of it.
Absolutely.
Amanda, did you have a question?
Yes.
No? Okay, sorry.
Yes. Any questions for Bailey?
No, I was
Yeah,
just saying that
Bailey,
he
I just have a quick question. What are you doing now to really, I mean, we're still in it, you know? You guys are COVID free. What do you guys do for your staff to really keep them pumped up and just for the long haul? Because we know that this is a long haul. So
Absolutely.
now
So,
you're COVID free, that pumps them up, but now what's going on?
so we actually just celebrated CNA week. So we really took that opportunity to have, I guess, a little bit of fun in the building. So each day was dedicated to our CNAs. So one day our slogan was, our CNAs have knocked it out of the park. And so everyone dressed up as sports players. And I continue to, I have little care packages with motivational quotes that we've been passing out. We have some wonderful people in the community that have reached out, and typically once a week we're able to feed our entire staff, which is amazing.
Nice.
Yes. So it's been tough. We've also had a lot of support from Presby Rockwall. They've made posters for inside of our facility, just reminding us how great we are, and that we, you know, our employees truly are heroes. They did not put themselves first. They put our patients first and walked in every day with a smile and knew the risk that was there. But we followed protocol and we did what we had to do to take care of this is our family. So.
Beautiful. It's wonderful. I just have another quick question for you. What do you think the financial impact is now on your business with having to purchase all this PPE equipment and all the other things? How do you feel like that's going to get passed on, all this additional cost? Because I do know like some like assisted livings or things like that, some of that cost now has been put on the family of the additional equipment. But I would imagine with you taking insurance, you can't do that, or do you? Can you?
No, we do not. We do not hold our patients responsible for their safety. I believe that's fully our responsibility. So what we do, we had several volunteers. We've had a hand sanitizer company actually donate hand sanitizer, but our corporate office has been wonderful at sourcing that. I can't say that there has not been a financial impact. We did shut our doors to admissions. So when COVID was active in our building, we were not accepting admissions. So there was, of course, an impact there, as well as the testing. Each facility is paying for that testing. So there's quite a yes. But at the end of the day, each person's safety, I think, should always be more important than your financial loss, because at the end of the day, you can always make that up. You work hard, but each patient's safety is much more important.
Good job, Bailey. Good job.
So Bailey, I have a question.
Yes, ma'am.
What is it that you guys need at this point? If someone wants to help out, what can they do, and what do they need to go through to kind of help you guys?
I think we are on the latter end of it, and now it's just kind of back in defense mode to keep it out of the building because we are not safe. But I think Elizabeth said it best. These residents have not been able to touch their family since March. So I think any support you can give to them, if it's, I mean, just even writing the letters, we're reaching out to them. What we're doing when we do receive those, we hold on to them for 2 days just to make sure that they're disinfected, and then we do pass those out to the residents. So if you have kids at home, they can draw pictures, or anyone bored, just any long-term care facility, I encourage you to just send support to them, because it's a hard time. It really is.
Bailey, can you tell us, like if someone, you know, we wanted to send some cards in or something, how many, you know, patients do you have there, and how many of, you know, estimated staff members do you have? If somebody wanted to send like some tips, treats, or something like that, how many?
Absolutely. So on a given day, We probably have about 50 employees in the building.
Okay.
And then as far as residents, we have about 60 right now. So somewhere in there would cover everybody.
Okay,
Thank
good.
you.
Good to
Yeah.
know. Mhm.
I think the biggest of support is to talk in the community. And if someone does have an acute situation and they do have a family member that has rehab, I think the biggest support is to have them give Broadmoore a try, because in the end, they did and we all did everything we were supposed to do. And the fact is that team stuck together and they are in it for the residents. And that is the biggest support, is to also, if you have someone that is in the Rockwall area or family members that in the Rockwall area, that rehab team, that nursing team, that administrative team, every one of them need the support to start growing again, because that is something that will give back the most in regards to everything, is to believe and give back, because they deserve it in regards to doing everything they did, especially Bailey.
Thank you.
She's gonna make me cry, so I'm gonna get off.
I absolutely, and our goal at Broadmoore is to just be 100% transparent with the community. So if you talk to anyone that has questions or thinks otherwise, there's a lot of people that aren't knowledgeable about skilled nursing. There's been, unfortunately, a lot of bad publicity, but I reach out to every single one and invite them to speak with me. I'd be happy to give them facts, because Rhonda's right. I mean, with 118,000 cases in nursing facilities, it can't be because of the care or infection control. I mean, this is a very serious virus and it can happen to anyone at any time. And so I truly believe just being a community, being Rockwall strong and building each other up is going to get us through this.